Nigeria's nurse migration crisis keeps growing and is hitting the health sector hard. Many nurses live in search of better conditions abroad, live in public and private hospitals, short-staffed and overstretched. Here's more in this report.
People often blame salary alone for the steady exit of Nigerian nurses, but conversations inside the system tell a deeper story. At Garki Hospital, the head of nursing says many nurses leave because they feel undervalued and sidelined in the workplace. Respect and recognition matter as much as pay.
Not paying doctors, but that's why they are moving. No! Many of us are frustrated because we don't have something to work with. I'm not trying to say that salary is not part of it, but the main reason some of them feel that, we are the ones signing some of the papers, and what are the purposes of them? Where they say purpose, they will write greener pasture. Greener pasture in what? Practicing what you have learnt. Seeing people getting out alive. I'm an ICU nurse, I'm an intensive care nurse. And the joy we have there is that you have something to work. This patient was brought in, half dead, but you know it's a reversible case. Most times, because you have things to work with, because you have to see that person smiling out of ICU. That's the beauty of you working in a hospital.
Nurses say they want a system that listens to them, provides structure, and supports their growth. Some describe how the lack of professional respect pushes them out faster than the pay gap itself.
When you go over there, no matter where you are, you know that your family is safe. You know that everybody is safe. You have a conducive working environment. There's respect for your profession. People value your work. Not in some places, some people even look at a nurse as if she's a nobody. Do you understand? So there are a lot of factors.
So everybody wants to have a good life. So because they want to have a good life, they always look forward, they search for where to see that good life. And you know, in the Europe, their services is always welcome because they know the importance of the nurses. So because of that, and the kind of remuneration and packages they have for them over there is always a fascinating, desire for everyone to begin to look forward to go abroad.
Stakeholders want that without better working conditions and modern equipment, hospitals won't function well enough to keep their workforce. The nursing HOD stresses that government action is overdue and that improvement must start with fixing the basics inside hospitals.
If the government will help us in all these hospitals, set it up. We know roads are good, like in Abuja, I see a lot of roads. I say, but there's no manpower, that human touch. The minister can do that. The minister can go to these hospitals. These are places you see people will be blessing you without you knowing they are even blessing you. These are places you see that somebody has done something that touched every family.
If poor working conditions persist, Nigeria will lose even more trained professionals. Nurses on the front line say the warning signs are clear. Tanti Azal, Trust TV News, Abuja.